TwoDay Method, Natural Effective Family Planning. Natural methods of family planning help individuals achieve their reproductive goals to either prevent or achieve pregnancy. A woman or couple can either track the days of her cycle to identify the fertile window, the days on which she is most likely to become pregnant, or she can observe and keep track of the signs her body is showing her to identify the fertile days. A couple can avoid intercourse on days identified as fertile days to prevent a pregnancy. There are several natural methods that are commonly known. Only some of these methods are considered modern methods. What makes a method modern is that it is based on a sound understanding of reproductive biology, follows a precise protocol for correct use, and has been tested in an appropriately designed study to assess efficacy under various conditions. In the last decade, two simple and effective methods were developed and tested by Georgetown University's Institute for Reproductive Health, the Standard Days Method, which identifies a fixed fertile window in a woman's cycle, and the TwoDay Method, which determines a woman's fertility status based on the presence or absence of secretions that she observes. The United States Conference of Catholic Bishops also has information about a number of natural family planning methods on their website. Why develop new natural methods of family planning? Simplicity. A large barrier to using natural family planning methods is the perceived complexity of some of the methods. Standard Days Method and TwoDay Method developers wanted to make simpler methods that could be provided by and used by anyone, regardless of education, thereby increasing access to family planning. In this course, we will take a closer look at TwoDay Method, discussing the following: the characteristics of the method, the scientific basis of the method, the research and development behind TwoDay Method, the effectiveness of the method, and finally, the TwoDay Method algorithm, which guides the user to know if she is on a fertile day or not. Let's review our learning objectives for the TwoDay Method of family planning. At the end of this course, you will be able to describe the characteristics of TwoDay Method, explain how TwoDay Method works, summarize the scientific basis and efficacy of the method, explain how to provide the method, and describe how and why programs include this method. TwoDay Method is a fertility awareness-based natural family planning method that relies on the presence or absence of cervical secretions to determine if the woman is fertile or not. Let's look at this brief video introduction.
TwoDay Method is one of the many family planning methods available. TwoDay Method is a simple, fertility awareness-based family planning option. This natural method allows a woman to identify when she is fertile based on the presence or absence of vaginal secretions. If the woman has observed any cervical secretion today or yesterday, it is likely that she is fertile and should avoid sexual intercourse today if she does not want to get pregnant. If she did not have secretions yesterday or today, which is to say, 2 days in a row without secretions, then it is a safe day and pregnancy is not likely today. This method was tested in a study and found to be 96% effective with correct use and has been included in the World Health Organization norms and guidelines.
Let's look at the characteristics of TwoDay Method. It is a natural method of family planning, which means a user doesn't take any medications or put anything in her body. So how does TwoDay Method work? This method helps women to know which days of their menstrual cycle they are fertile or can get pregnant. On those days, the woman and her spouse avoid sex to prevent pregnancy. She identifies which days are fertile by checking for secretions, which are any fluid other than menstrual bleeding coming from the vagina. The woman checks her secretions daily. She considers herself fertile if she notes secretions of any type that day or noted them the day before. If she notices any secretions today or yesterday, she considers herself fertile today and does not have sexual intercourse today. There is no cycle length requirement to use TwoDay Method. As with most other family planning methods, TwoDay Method does not protect against STIs or HIV. We've said that the 2-day method identifies a woman's fertile days based on the absence or presence of secretions today and yesterday. By checking for secretions each day and applying this algorithm, she will know if she is on a fertile day or not. Let's look at the algorithm more closely. The user has to ask herself, did I note secretions today? If the answer is yes, then she can get pregnant today. If the answer is no, she then asks, did I note secretions yesterday? If the answer is yes, then she can get pregnant today. However, if the answer is no, then she has had no secretions today or yesterday, 2 days in a row, and pregnancy is very unlikely. By avoiding sex on the days identified as fertile days, the couple can prevent a pregnancy. But we need to learn more about what secretions are and why they are such a good indicator of fertility. Let's review this in more detail. Why are secretions a good indicator of fertility? When secretions are more liquid or have a greater water content, they detach easily from the walls of the vagina and are more detectable around the vulva and entrance to the vagina. In contrast, when secretions are thick and sticky or have low water content, they don't detach, are not expelled, and are not detectable around the vulva or exterior genitals. If secretions are present, it is highly likely that the woman is fertile. If she is not having secretions, then a pregnancy is almost impossible. An international multi-center study was conducted to test the efficacy of 2-day method. 2-day method was provided to clients of public and private sector family planning programs. The efficacy study included the menstrual cycles from 450 women in Guatemala, Peru, and the Philippines. Women admitted to the study were interviewed monthly up to 13 cycles. In the study, health personnel were trained to offer 2-day method to their clients. Clients who were interested in using the method were screened according to specific criteria. If they met the criteria, they were taught how to use the method. They were followed every month for a little over 1 year to collect data about their menstrual regularity, their use of the method, their satisfaction with the method, and whether they had gotten pregnant, etc. Of the 450 women enrolled in the study, 47 became pregnant. Results showed that with correct use, the pregnancy rate is 3.5, and with typical use, the pregnancy rate is 13.7. Results of the efficacy trial were published in Reproductive Endocrinology in 2004. Why are secretions so reliable as an indicator of fertility? Because they're not only a signal or indicator of fertility, secretions are a factor of fertility. Reproductive hormones from the pituitary gland in the brain send a message to the woman's ovaries to release an egg about every 28 days. Cervical secretions are actually necessary for the woman to be fertile. If there are no secretions, she cannot be fertile and cannot become pregnant. She can tell on a day-to-day basis if she is fertile or not. If her cycle is slightly different from previous cycles, for example, on this cycle, she will ovulate a few days earlier or later, she will get these signals on slightly different days, always following what is happening in her body on this cycle. Or she will not ovulate this cycle, and her body will probably not give any fertility signals. Remember, if she has no secretions, she cannot become pregnant. Let's reflect for a moment. How effective do you think 2-day method is? As we saw, the 2-day method of family planning was shown to be 96% effective when used correctly in a clinical trial. The results were published in the journal Reproductive Endocrinology and can be found in the resource library. What are some of the benefits of a natural method like 2-day method? As a natural method, some of the benefits of 2-day method are that the user does not have to take anything or inject anything, and there are no side effects. 2-day method is a knowledge-based method that requires the user to observe the changes in her body, so there's no commodity needed and therefore cost-effective. Since 2-day method is a couple method, it gets the husband involved in family planning. Another benefit of 2-day method is that there is no cycle length requirement, which means that any woman with healthy secretions can use the method regardless of cycle length. What are some of the challenges of 2-day method? The couple must be willing to abstain during the fertile window and decide how to manage those days. Like most family planning methods, it does not protect against HIV or other sexually transmitted infections. For more information, refer to the following in the resource library: Efficacy of the 2-day method, Reproductive Endocrinology 2004, the 2-day method fact sheet, and 20 most frequently asked questions about TwoDay Method. It is important to put this information about efficacy or pregnancy rate in the context of other user-directed methods. Of 100 women using no method of family planning for 1 year, 85 will become pregnant. During typical use, those who use spermicides, a diaphragm, or condoms every time they have sex, 29, 16, and 15 respectively will become pregnant during the first year of use. Oral contraceptives are more effective, with 8 women getting pregnant with typical use. 2 well-established natural methods, symptothermal and ovulation, are effective with perfect use, but have very high failure rates with typical use, 18 and 20 respectively. Clearly, the TwoDay method is as or more effective with correct and typical use than some of the other user-directed methods, with a pregnancy rate of 4 with correct use and 13 with typical use. Here is another way to compare the natural family planning methods available. The first row identifies the fertile signs that are monitored in order to use the method, and the second row shows the pregnancy rate. Again, TwoDay method is comparable in its correct use rate and comparable, or in some cases better, in its typical use rate. This comparison of natural family planning methods includes the number of sessions required to teach the method, the length of those sessions, and the supplies needed to use the method. TwoDay method does not require supplies, although a recording card is available to help users keep track of their secretions. TwoDay method only requires 1 session of 20 to 30 minutes, whereas some other methods require multiple, longer sessions over a period of time. You can see the references for this table in the resource library, References for the Natural Family Planning Comparison Table. Who might be interested in using TwoDay method? TwoDay method can be used by any woman regardless of cycle length as long as she has healthy secretions. Couples interested in a natural method and who want to plan their families with the Church's teachings can use this method. TwoDay method is a simple, natural method. Couples only need to know that the presence of secretions are an indicator of fertility, and by asking the 2 questions each day can know if the woman is on a fertile day. Couples will need to be able to abstain during the fertile days to prevent a pregnancy. The couple needs to be in agreement and decide how to manage those fertile days. How do you offer TwoDay method? Protocols have been developed and tested for offering TwoDay method to clients, similar to protocols developed for other family planning methods. Job aids are available in the resource library to help guide the screening and teaching of users. Opportunities to apply the job aids will come a bit later. There are 3 components of TwoDay method counseling. Screening. Help the client determine if TwoDay method is appropriate for her. A screening checklist for the initial visit for teachers to use during screening is available. Teaching. Provide the client with information and instructions on how to use TwoDay method correctly. The back side of the screening checklist reviews the information she needs to know. This information is also on the brochure that she'll take home with her. Supporting. This is where the NFP teacher can explore and discuss couple issues and support correct method use. What should the teacher do to offer TwoDay method to a potential user? Determine that the woman is interested in using the method. This suggests that clients have to be aware that the method exists. Programs and providers should make every effort to inform their clients and the communities they serve about all methods of family planning available. When a new method is offered, a special effort is needed to let people know about it. Ascertain whether the method is appropriate for her, that she has healthy secretions and is able to check for secretions every day, several times a day. She and her husband must also be able to abstain on the fertile days. Explain the method to her. Explain how to check for secretions and mark the user card to know whether that is a day when she should avoid intercourse. Ask the client to demonstrate back how to mark the user card to verify that she understands when she is fertile and should avoid intercourse to prevent a pregnancy. Provide her with a user card and the brochure to take home, as well as any other materials to help her use the method.
Good morning, my name is Sandra. I'm going to talk to you a bit about the different family planning methods available at our clinic.
Interested in TwoDay method, explain
now
briefly
that we
what the
have
method is
reviewed
about,
all the methods,
so she can
you have
decide if
asked
it is
for
a
more
method that will
information
work for
about
her
the
and her
TwoDay
spouse.
method. It
Watch
is a
the
natural
provider
method that
explain
is
how the
very
method
effective
works.
if used correctly according to the instructions that I give you. It is a method that requires you to check for secretions.
What kind of secretions do you mean? You may have noticed that after your period stops, there are a few days when you don't see secretions, and then they begin to appear in small amounts. As the days go by, the amount of secretions increases. Have you noticed this? This is how the method works, identifying the secretions, and it is called TwoDay because we consider the presence of secretions both today and yesterday. We have to take note of whether there were secretions yesterday and if there are secretions today. What days can you get pregnant? You can get pregnant if you had secretions today or if you had secretions yesterday. On those days, you can get pregnant. What days can you not get pregnant? If you did not have secretions today and you did not have them yesterday, that is to say, 2 days in a row without secretions. Or if you're menstruating, then on those days, it is not likely that you will get pregnant. Anytime you notice secretions, either today or yesterday, you immediately know that today is a fertile day. To avoid pregnancy, do not have sex if you had secretions today or yesterday.
Now the client knows what 2-day method is about. The next step is to screen to make sure she is eligible to use 2-day method. What are the requirements to be able to use this method? The World Health Organization, in its publication Medical Eligibility for Contraceptive Use, states that 2-day method, like other fertility awareness-based methods, poses no adverse risk to women who choose to use it. But 2-day method is intended for women who meet certain criteria. What are those criteria? The woman's secretions should be healthy. Healthy secretions are not itchy or painful and do not smell bad. Any of these symptoms could be an indicator of an infection, and the woman should visit a healthcare provider. The woman will need to be able to check for secretions every day, at least twice a day in the afternoon and evening. The couple must be in agreement on avoiding intercourse on her fertile days when she can become pregnant. If either member of the couple is exposed to the risk of sexually transmitted infections, the 2-day method, like most other family planning methods, does not protect against these infections. While the 2-day method will work for most women, it is important to assess whether the method is appropriate for the individual woman. To establish if 2-day method is an option for her, first determine that her secretions are healthy by asking if she's ever noticed secretions. Ask what they look like to verify she is noticing the right thing, and ask if they are ever itchy, painful, or smell bad. This is an indicator of secretions that are not healthy, and she should see a healthcare provider. Studies in several countries have found that most women have noticed their secretions and are aware of them. Second, ask if she will be able to check for secretions every day, several times a day. She will need to check each day to be able to determine if she is fertile today. Ask what are some of the ways she will remember to check for secretions. While there is no cycle length requirement to use 2-day method, the user must consider that the secretion patterns are different for all women, some producing more secretions than others. This could limit the number of days where pregnancy is unlikely and is something for the woman and couple to consider when determining how to manage their fertile days. Now that we've seen what the eligibility criteria for using 2-day method are, let's practice. Let's look at some real-life situations that you might encounter. We're going to look at 3 case studies. Read each one and think about the eligibility criteria for using 2-day method and answer the questions in the slide for each case. Take notes on your thinking and the answers will be shared after the case studies. Case 1. Maria. Maria is 26 years old and has 2 children. The youngest is 3. Maria has never used a method, and she and her husband use withdrawal most of the time. The couple would like to use a natural method, but her husband couldn't come today. After hearing of the 2-day method, they think it would be a good choice. The NFP teacher has determined that Maria's secretions are healthy and that she is willing to check her secretions daily. She is on the 3rd day of her period. Can Maria use the 2-day method? What are some recommendations to offer this couple? Case 2. Sarah. Sarah became interested in the 2-day method after hearing about it from a friend. She is still breastfeeding her 7-month-old child. She has had 4 periods since her child was born and expects her period to begin again next week. She has noted a discharge sometimes, and it matches the NFP teacher's description of healthy cervical secretions. She says she is willing to check her secretions daily, but she is worried about remembering to do it and whether she will know if secretions are present. She has had sex since her last period. Can Sarah use the 2-day method? What are some recommendations to offer her? Case 3. Dora. Dora wants to use the 2-day method. She has been married for 8 years and has 3 children. She was using the pill up to 2 months ago, and now they use withdrawal sometimes. She does not want another pregnancy, but she does not want to use the pill either. Her secretions are normal, and she's willing to check herself on a daily basis, but is afraid she'll forget. Her last period started approximately 10 days ago. Can Dora use the 2-day method? What are some recommendations to offer her? Let's review the answers case by case. Maria. Yes, she can use 2-day method. You can remind the couple of the importance of agreeing to avoid sex on the fertile days and make some suggestions about how he can be involved in helping to use the method correctly by reminding her to check for secretions and recording each night. You also know that Maria is on the 3rd day of her period, so you can help her see where in the menstrual cycle she is and what she can expect in the coming days. You can also help her to start marking her recording card. Sarah. She can use the method too. Sarah will need to discuss the method with her husband, and both need to understand that avoiding sex on the fertile days is essential to successful use of the method. Give her some tips on how to remember to check for and mark her secretions every day. Since she expects her period next week, show her where she is on the menstrual cycle and what she can expect. Also, since she has had sex since her last period, let her know that she could already be pregnant and she should visit a healthcare provider if her period doesn't come when she expects it to. Dora. Dora can use the method as well. Dora needs to discuss the 2-day method with her husband and make sure they are in agreement about using the method and abstaining on the fertile days. Also, since she recently used the pill, this could cause more or fewer days with secretions than she would normally experience, and this should regulate over time. Offer her some ways to remember to record her secretions. She started her period 10 days ago. Show her where she is on the menstrual cycle and what she can expect. After screening for healthy secretions, the next step is to explain to the client how to use the method. Use the cue card during teaching to remember the key points to cover. The cue card is available on the back of the screening checklist and on the brochure that goes home with the client. On the cue card you will cover what secretions are and when the woman can expect to see them, how to check for and record her secretions, when she should return to her provider, that she and her spouse will have to agree on how to manage the fertile days. Asking clients to explain back is a good way to determine whether the instructions were clear and clarify them as needed. Remind clients that the instructions discussed are also included in the client brochure. Let's take a closer look at explaining what secretions are and when they happen. We start with the menstrual cycle. The cycle begins on the first day of bleeding, or period, and ends the day before the next period starts. Every time the period starts is a new cycle. This happens over and over again during the years a woman can bear children. Some women bleed for 3 days, others 5 or 6 or 7 days. Each woman is different, and that is normal. Also, different women have their periods come at different times. Some women have cycles that last longer than others. During the cycle, about a month, a woman can become pregnant for several days in a row. These days are the days around the middle of her cycle. Generally, these are the days when she has secretions. So what are secretions? Secretions are the fluid or wetness other than her menstrual bleeding that a woman can notice in her genital area. They are also a sign that a woman can get pregnant. So when does a woman see secretions in her cycle? After her period ends, she will have a few dry days. Then secretions will start to appear in very small amounts. She will have to pay close attention to see them. As the days go by, the secretions will become more abundant and the secretions are easier to see and feel. After several days, the amount of secretions will diminish until they disappear. More dry days will follow until her period starts again. Once the secretions start, they continue for several days in a row. Not all secretions are the same. As the days go by, they will look and feel different. This happens every month. A woman can start using TwoDay Method at any point during her cycle. During the Efficacy study, users were directed to start within 7 days of their most recent period. An additional study was conducted to measure use of the method using a quick start approach, beginning the method at any point in the cycle. No significant differences were observed in correct use, continuation rates, or acceptability of the method between women who were counseled at different points in the cycle. These findings suggest that women can be taught and successfully learn to use the method at any time in their menstrual cycle. Teachers should help a client identify where she is in her cycle so she knows what she can expect. What are some special circumstances that might affect secretions? A woman who has recently given birth or is breastfeeding may experience more days with secretions. Likewise, women who recently used a hormonal method might experience more or fewer days with secretions. These circumstances do not affect the efficacy of the method since secretions are needed for the woman to be fertile. If she experiences fewer days with secretions, she will not be able to get pregnant because of the absence of secretions. If she experiences more days of secretions, she will have more days identified as fertile days. How do women check for secretions? Let's watch a provider explain how to check for secretions.
There are different ways to check for secretions. One way is to check for secretions using your fingers. Be sure your hands are clean because you will be touching your genitals with your fingers. Another way of checking is by using toilet paper, but check before urinating. Before urinating, use the toilet paper to wipe, and if there are secretions, you will see them because the paper is going to be shiny and also slippery. If you use toilet paper to check for secretions, always wipe before urinating, because if you urinate, then wipe, you may confuse it with secretions. Another way to check is touching, as I explained, and another is looking on the underwear. On the underwear, you can check for traces of secretions.
Let's review. As you teach this method, you will need to help the woman become comfortable with checking for secretions. What are the ways a woman can check for secretions? She can see secretions on her underwear or toilet paper. Secretions appear in very small amounts. It is always recommended that a woman look for them either on the toilet paper or on her underwear, especially on days immediately following menstruation. She can touch her secretions to notice them. Although it is not necessary to touch them, sometimes this is the most effective way to check for them if she's not sure what she is seeing. She can also feel secretions. She can pay attention to whether or not she feels moisture in her genital area. She can do this without interrupting her daily activities. As she becomes more familiar with her body and what secretions feel like, this will become easier. It is also important for the woman to establish a routine to help her remember to check daily. For example, a woman can make it a habit to check each time she goes to the bathroom before urinating. Remember, she needs to check for secretions at least twice a day in the afternoon and evening. What are some things to talk about with a new user? We just discussed that a woman can see, touch, or feel for secretions. At first, she may want to look or touch to make sure she is observing secretions. However, in studies, participants indicated that over time they learned to feel the presence of secretions. Again, in the beginning it may be more effective or confirming to see or touch secretions and learn to feel them later on. It might also be effective to see or touch at the beginning or end of the fertile time when extra attention is needed to note secretions. To use TwoDay Method correctly, it is very important for the woman to remember to check for secretions every day in the afternoon and evening. Checking after midday will help the woman learning to use the method to avoid confusion with semen if she and her husband had intercourse the night before or in the morning. She should check for secretions several times, making her final notation before she goes to bed. Now that we have learned the different ways to check for secretions and ways to remember to check her secretions every day, a woman can use this information to know if she can or cannot get pregnant on that day. Recording secretions will be the primary way for the woman to keep track of her secretions and know if she is on a fertile day or not. She will note the start date of her last period, if she remembers it. Then she will note her observation, period, no secretions, or secretions every day. She marks her observation for the day each night before going to bed. There are 3 symbols that the woman will use to choose from to mark each day. If she is having her period, she will mark the filled-in circle. If she has no secretions, she will use the open circle. And if she has secretions, she will use the X. When is the woman not at risk of getting pregnant? If the woman did not have secretions today and she had no secretions yesterday either, she doesn't get pregnant today. This means that she must have 2 days in a row without secretions to consider herself not fertile today. Also, if she is on her period, there is no pregnancy today. When can a woman get pregnant? A woman can get pregnant today if she had secretions either today or yesterday. If she forgets to check for secretions, she should mark an X and consider herself fertile today. To prevent a pregnancy, the woman and her husband must not have sex on the days she can get pregnant. These are all the days she has secretions, and remember, this method looks at 2 days, yesterday and today. If she has no secretions today, but had secretions yesterday, she can still get pregnant today. Let's practice marking the client recording card. On the left, we have a sample of observations for a menstrual cycle. Each day has a corresponding symptom. Use the sample cycle observations and think about how they should be marked on the card. If you have a recording card in front of you, available at naturalfp.com, you can mark there. Otherwise, you can use a piece of paper. The correct marks will be revealed on the right in a moment. How did you do? Here is the sample card that we just filled out. Let's look at some specific days and determine if they are fertile days or not. Is this first Thursday a fertile day? No, it is not a fertile day. Because it is a day where she is having her period today and had her period yesterday, she is not fertile today. Is Monday a fertile day? No, this is not a fertile day either. She had no secretions today and she had no secretions yesterday. How about Tuesday? Yes, this is a fertile day. She has secretions today, so today she is fertile. How about Wednesday? Yes, Wednesday is also a fertile day. She had secretions yesterday and she has them today, so today she is fertile. What about Sunday? Yes. Even though she had no secretions today, she did have secretions yesterday, so today is considered a fertile day. And how about Monday? Is Monday a fertile day? No. She did not have secretions today, and she didn't have any secretions yesterday. That is 2 dry days in a row, and she is not fertile. If you can, pause this presentation and practice teaching a friend or colleague how to mark the card and share the sample cycle with them. Did they understand your explanation? What are some strategies to help the woman remember to check for secretions every day? Possible strategies include to make checking a routine when she goes to the bathroom, checking at set times of day in the afternoon and evening, and right before she goes to bed. She could also set a reminder on her phone, if appropriate, or her husband can help remind her to check. She will need to record her final observations before she goes to bed each night. Her husband can help her here, too. She could keep her recording card near their bed or on a night table as a reminder to make the recording. As with many things, repetitive action will become habitual over time. The woman and her husband will have to be in agreement to avoid sex on the fertile days and communicate with each other about how to manage those days during her cycle. To help the couple determine if they will be able to manage the fertile days, ask, will you be able to avoid sex for several days in a row when you can become pregnant? Can you talk openly about when to have sex and when to avoid it? What do you think you can do on the fertile days? Consider the questions and the reflection in the slide. What are some of the challenges that couples will face using TwoDay Method? How will they deal with those challenges? Does this vary from community to community? In what ways? Couples can find it difficult to manage the fertile days. However, if they have a plan in place for how to communicate and deal with those days, it is easier to manage. Couples handle the fertile days in different ways. There are many ways to show intimacy. Sometimes sleeping in a different room helps couples avoid intercourse. Being able to talk about it amongst themselves is critical. How can men participate in using TwoDay Method? They can help remind the woman to check or record her secretions every day, and he can help by respecting the fertile days. Although no follow-up visit for the TwoDay Method is required, if the woman experiences any of the following, she should return to her NFP teacher. If she had less than 5 days or more than 14 days with secretions. Less than 5 days could mean that she is not identifying or observing the presence of secretions properly. More than 14 days could be an indicator of an infection, as could secretions that smell, itch, or are accompanied by pain. If she or her husband are having difficulty handling the fertile days. If her period has not returned and she thinks she might be pregnant. Or if she would like to use another method. After a client makes an informed choice to use TwoDay Method and the NFP teacher determines that she meets the criteria, the teacher and client should discuss in greater detail how to use this method and address any additional questions or misconceptions the client may have. Specifically, they should discuss how effective TwoDay Method is and how efficacy is affected by a woman's ability to follow the requirements of checking and recording secretions to know if she is on a fertile day or not. Also, they should discuss working with her husband to avoid sex on fertile days, how TwoDay Method works to prevent pregnancy, strategies for managing the fertile phase, and when to return to her teacher. The NFP teacher should remind the client that what has been explained is also described in the client brochure. She can review the brochure with her husband to start using the method. The client and NFP teacher should also discuss the fact that TwoDay Method does not protect against STIs or HIV. Finally, the teacher should discuss when to return, which was described in more detail on an earlier slide. As programs and providers begin offering TwoDay Method, needs for resources to support training, service delivery, etc. may arise. There are many resources available to support TwoDay Method training and service delivery, all of which are available for download at www.naturalfp.com. Thank you for participating. If you are interested in receiving a certificate of completion, please complete the post-test and practicum activity at naturalfp.com.